All right, welcome back now to the KFYR Plus News Desk. And if you've ever had chickenpox, the virus that causes shingles is already inside your body. Now, this is the case with 99% of adults over 50 in the U.S. Although not everyone will develop shingles, the virus can reactivate at any time. And risk increases as the immune system naturally declines with age. Shingles can be very painful and isolating experiences leading to rashes, blisters, and scabs that may take several weeks to heal. Next week is Shingles Awareness Week, and joining me right now to discuss the topic is Dr. Bio Curry Winchell, physician and health advocate, and Larnie, nurse, shingles advocate, and mother who developed shingles when she least expected it. Welcome to you both. I appreciate your time.
Thank you for having us.
Glad to
You
be
got
here.
it. Dr. Bio, let's start with you. What is shingles and how is it caused?
Shingles is caused by the virus varicella zoster. It's the same virus that is found with chickenpox, and it lies dormant in the spine and can reactivate at any period of time.
Why are people over the age of 50 more at risk?
After the age of 50, our immune system starts to decline, which can increase your risk for developing shingles. The other thing to think about is asthma, diabetes, COPD, all of those are also associated with an increased risk of developing shingles.
And what are some of the common symptoms of shingles, and how can it affect a person's daily life?
So typically it presents as a rash on one side of the body, and patients will share that they thought they had a pimple or just like a simple rash. Well, then it starts to blister and scab, and then there's this kind of painful burning sensation as if your skin is on fire. And those symptoms unfortunately can last for several weeks, and in rare cases can actually last for years.
Larnie, let's turn to you. Could you tell us more about your experience with shingles?
Yes, happy to share, and thank you for this opportunity. My family and I were headed to a much-awaited vacation to Hawaii, and during the on the plane ride, I noticed a pimple near my forehead on the left side, and during the duration of the flight, the growth grew more, and by the time we landed, my husband and I decided to go to urgent care to be seen. The provider at urgent care recommended I go to the ER at the hospital. However, because this growth was happening near my eye, which is a big concern, and
Hmm.
so when talking to the specialist there in the ER, working with me and asking me questions, they diagnosed me with shingles.
What do you hope that people take away from your story, Larnie?
Yeah. The biggest takeaway that I want to share is, especially since it personally happened to me, I didn't expect it at all.
Hmm.
I'm young, I'm active, I'm healthy. And because of this experience, I've actually learned how to prioritize my health, my well being, and sharing this message. And I encourage those 50 years old and older to talk to your provider or your pharmacist about your risk for shingles and about vaccination.
Dr. Bio, what steps can individuals take to reduce their risk of developing shingles?
The first step that you can take is just having a conversation with your doctor or with your pharmacist and finding out your potential risk for developing shingles.
And Larnie, why do you think there is a lack of understanding about shingles among people over the age of 50?
That's a good question. And it's really finding that opportunity to talk to your provider about it and allowing the provider to be able to ask you the questions. And so to be able to determine, what's best for your health, how to invest in your health so that, situations and medical conditions are more are more known about, and it's really all about increasing awareness.
Sure. Dr. Bio, what should someone do if they suspect they do have shingles?
The first thing to do is seek out care and have a conversation with that clinician and lead with that and share, I think I have shingles. I think there's power and really being able to highlight what you think you have. And that's why these types of conversations are so important. When we're talking about shingles, we are now planting the seed about this disease. And that gives people the information to know about the symptoms, to what to look for and what to ask when they seek care.
Sure. Larnie, if I could ask you just one more question. On your plane trip to Hawaii, and really, I'm so sad that you had this beautiful trip to Hawaii and you end up getting shingles, but was there anything internally that you felt? Was there a fever? Were you not feeling right that, other than the physical pimple that you said that started?
Yeah, there was some symptoms aside from the growth. Is I actually started to feel a glare. I think because it was near my eye area. I
Yeah.
felt a glare, and I asked my husband, "Can I borrow your sunglasses?" Because something felt different, and that's when the decision to go to urgent care was the right thing to do.
Dr. Bio, what questions should we ask our doctor or primary physician or even pharmacist about shingles?
The first thing to do is really have that conversation with your doctor or your pharmacist about your potential risk for developing shingles. And then also thinking about risk factors. Studies have shown if you have diabetes, heart disease, asthma, or COPD, that increases your risk for developing. So starting there is the first step in knowing more about your health, and then you can make those decisions on what is best for you.
Okay. And Dr. Bio, where can we learn more information?
A great resource is easyvax.com.
EasyVax.com. Thank you so much for taking the time to speak with me today. Your insights on shingles and the importance of the awareness and vaccination has been incredibly invaluable, and I'm sure the audience found it very informative. Thank you so much to Larnie and Dr. Bio.
Thank you for having us.
Thank you.
You got it. All right, time now is 11:46. Quick break here at the news desk, and we'll be right back here with more local news next on KFYR Plus.